Do you know that there is a difference between an emergency department and the casualty? Have you ever wondered when you should be visiting an emergency department and when you don't need to? Hi, my name is Dr. Mary Alex. I work as a specialist in emergency medicine. In today's episode, we're going to talk about emergency medicine department, when you should be coming to us and when you don't need to come in as an emergency patient. When should you actually go to the emergency department? Let me simplify it. You should go to the emergency when something feels sudden, severe or scary and waiting could make things worse. For example, chest pain, breathlessness, seizures, high fever with confusion, trauma or any sort of accidents, poisoning, severe bleeding, loss of consciousness, or if you notice that you can't see something clearly, all these are considered to be emergencies. Now let's clear a very common doubt: casualty versus emergency department. In many hospitals, casualties are usually run by medical officers or MBBS doctors. They provide you first aid, symptomatic treatment, and refer you to the other departments if required. An emergency department, on the other hand, is being run by doctors who are trained and specialized in emergency medicine. In the ED, we don't really wait for referrals to start your treatment. We treat your symptoms, we evaluate all the possible causes by running a few investigations, we stabilize you immediately, and we also manage all the life-threatening conditions on the spot. That's why in true emergencies, visiting an emergency department can actually save a lot of time when compared to a casualty. Emergency department is actually designed to save lives. They are equipped for rapid stabilization, 24/7 access to advanced tools, trained teams, and resuscitation facilities. We are actually trained to handle conditions like heart attack, severe sepsis, trauma, stroke, or cardiac arrest, the things that simply cannot wait. That being said, emergency is not meant for common cold or a cough which is lasting for a week, or a back pain which is there since your childhood, or routine blood checkups, or to follow up some investigations that you've done in some other OPDs. If it's the first day of fever, with no warning symptoms, and if you don't have an allergy to paracetamol, you can actually take a paracetamol at home, take some rest, drink lots of water, and wait for the next OPD visit. If you're unable to eat, you're not able to take oral medicines properly, you're vomiting continuously, and you think you cannot manage yourself at home, then it's absolutely okay to come to emergency. One last important point is that by law, all the hospitals are mandated to provide emergency services and stabilization. No one should be denied life-saving treatment. If you're unsure, it's always okay to ask for help. But if you feel something is sudden, worsening, or if you feel something is wrong, please do not wait. Emergencies are about time. And sometimes coming early makes a lot of difference. In India, emergency departments are at open access. Anybody can walk in at any time for any complaint. But it also means the emergency departments often manage true emergencies and non-urgent problems at the same time. Understanding when to use the ED is very important in India. Using the ED wisely helps ensure that when someone's life is dependent on minutes, the system is ready for them. So next time, when your one-day fever is not getting a priority treatment, please don't go and shout at the doctors because they would be busy saving some lives. And please help us save the resources for the people who actually deserve it.